And welcome to Local Edition on Time Warner Cable. I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about two disparate issues: Medi-Cal reimbursement rates and also environmental protection. My guest is Jeff Stone, a new senator from Riverside County.
Hi, Steve.
Thanks for being here.
Delighted to be here with you.
You are a pharmacist.
Yes.
And you're a Republican.
Yes.
And the reason I bring up both of those is that Governor Brown did not increase reimbursement rates for Medi-Cal providers in his proposed budget. And as a Republican, you want to see more spending in this regard.
Exactly.
Which is kind of interesting.
Exactly. As you know, Steve, 1/3 of the state of California now is on the Medi-Cal program. And the problem is that we don't have a pool of doctors that are willing to accept Medi-Cal. So we have this insurance plan for people that are depending on this plan for their health services delivery.
And it's expanding.
And it's expanding, but we don't have providers to provide the service. And so yesterday last week we had at our budget hearings, I talked to the governor's representative on the budget and said, not only have doctors taken a 10% decrease in their fees, but even before the 10% decrease, they were the lowest paid physicians with a state Medicaid program of any other state in the union. If we're going to make this covered California successful and take care of all these people that need the health care, we need to ensure that physicians are getting a return on their visits with their patients. Otherwise, they're not going to accept the insurance, and we're going to have a catastrophe of a program here in the state.
Well, are you getting any traction with this? Because, the governor usually has the last word, and it's his budget, and he usually ends up winning the battle. But I know there's a lot of sentiment to increase reimbursement rates so that you can get the providers to provide.
Exactly, and I think that there was some support from my friends on the other side of the aisle when I brought up this issue, that we need to make sure that, obviously it's not a fee that's going to make doctors wealthy, but we can't have a fee that doctors are going to lose money every time they see a patient. And then we also have to streamline a process called the Treatment Authorization Review in Medi-Cal. Right now, if you have a procedure that isn't typically covered, you have to go through a plethora of paperwork. And there's always this bureaucratic maze and delays in providing for that paperwork that gets the services that these constituents need, which is like healthcare rationing, or if somebody needs an emergency procedure, they got to go through this plethora of paperwork so the doctors know that they're going to get covered, or a hospital knows they're going to get covered. And coming from a county hospital, we had over $50 million in treatment authorization reviews that are almost a year old. So we need to find a way using technology to streamline those authorizations to make sure that our citizens get the health care they deserve and need.
Okay, I do want to segue to this other subject because
Sure.
I know you want to talk about it, and it's California's landmark CEQA, California Environmental Quality Act, which has been around since 1970 and has really thrust the state forward in terms of environmental protection and has given so many Californians the quality of life that they enjoy. But you think it needs to be reformed?
I do. Let's just say for the record that we all want clean air and we want clean water. But we have a duplicative regulation. We have NEPA, which is the federal equivalent to CEQA. But there are so many loopholes in CEQA that allows an unscrupulous attorney to file lawsuits against public projects, against private projects that cause significant delays and significant expense. And I can speak as an elected official in having a major bridge over a freeway that has litigation against it because they believe that there's a endangered species living on a man-made bridge that might need to be widened. We need to make sure that we can reform CEQA so that if an attorney files a frivolous lawsuit against a project, public or private, and if they don't succeed in a court of law, that they need to pay the governments or the private sector's attorneys' fees. And I think that would eliminate probably 75% of the frivolous claims. And let's get those jobs going, getting construction of freeway overpasses and freeways, and getting shopping centers built in the best interest of helping our economy.
All right. Well, we could talk about this for many more minutes. We'll have to get you back and spend some more time on it, talk in depth. But Jeff Stone, thanks very much for coming by.
My pleasure.
Appreciate it.
It's good seeing you.
Nice seeing you. And thanks to our viewers also for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on My Government on Demand, on YouTube, also on the California channel. I'm Steve Swatt. Have a great day.